Welcome, everyone, and thank you for joining us today. We will wait a minute to allow others to log on. Wonderful. Welcome to today's webinar. Thank you, everyone, for joining us. Today is an all-sector telebriefing focused on navigating the changes to the CalFresh and Medi-Cal programs. My name is Ramona Prado-Lyon, and I am with the County of San Diego Health and Human Services Agency, Department of Strategy and Community Engagement. I'm honored to be your moderator. We are here to talk about the changes to CalFresh and Medi-Cal. As you may know, several updates are taking place, but it's important to emphasize that not everyone will be affected in the same way. Our goal today is to clarify what these changes mean, who may be impacted, what steps community members can take, and what organizations can do to support the people they serve. Most importantly, we want you to know that you are not alone in navigating this process. Our team is here to support you, provide clear information and resources, and help you feel confident in sharing these updates with the communities you serve. Together, we can make sure individuals and families stay informed, stay connected to the benefits they qualify for, and receive the support they need. Thank you again for being here and for the work you do every day. So here's what's on the agenda. First, we will hear a presentation focused on the CalFresh and Medi-Cal changes. Next, we will share resources to support the community. After the resources, we will have a Q&A session. And lastly, we will ask you for feedback on today's webinar. So let's get started. A few reminders before we begin. This webinar is being recorded and your lines are muted. Additionally, AI note takers are not allowed. Please remember to submit your questions in the Q&A box, which is a button at the bottom center of your screen. We will do our best to answer your questions in the Q&A box, but if we don't get to your questions today or you want to reach out to our team, you can follow up with us via email at the email address listed on the screen and shared in the chat. We will also be sending out answers to questions in a follow-up email. Our speakers for today will be Ricardo Hernandez from the County of San Diego Self-Sufficiency Services and Anna Evangelista and Andrew Chossel from the San Diego Hunger Coalition. With that, I will pass it to Ricardo Hernandez to get us started.
Hi, everyone. Thank you for having me here. Ricardo Hernandez. I am the CalFresh and General Relief Program Manager in the Self-Sufficiency Services Department with the County of San Diego. And I wanted to start off today by just providing some information regarding HR 1, also known as the One Big Beautiful Bill Act, that was signed into law last year by the President on July 4th and introduced changes to Medi-Cal and CalFresh. Now, the changes will impact some customers, and we will provide an overview of those who are impacted. Now, to start off, for context, Medi-Cal is California's version of the Medicaid program. That's the name federally that it could be known as outside of California. It provides healthcare for individuals with low income, and CalFresh is California's version of the federal program, Supplemental Nutrition Assistance Program, also known as SNAP. The CalFresh program provides federally funded food assistance to people with low income. Now, HR 1 will bring changes over time. Some have already started and others that will take effect in the future. Today's presentation will focus on CalFresh, as we are still pending the policies from the Department of Healthcare Services related to the Medi-Cal provisions due to HR 1. Now, for CalFresh, we will take a look at this timeline here because there are going to be two provisions in 2026 that California will implement. For CalFresh, there is non-citizen eligibility changes that will begin on April 1st, or that begun, I should say, on April 1st, 2026. Some groups of non-citizens are no longer eligible to the CalFresh program based on these HR1 changes. New applications received on or after April 1st will be evaluated under the new rule. And then if somebody is in the group of non-citizens who are no longer eligible and they are currently getting CalFresh benefits, they will be reevaluated at their next renewal. Now, with a staggered implementation approach, not all impacted non-citizens will automatically lose benefits on April 1st. The next CalFresh change in 2026 is coming up in June. That's going to be related to work requirements. So starting on June 1st, the work requirements will be for the time limit that we call the able-bodied adults without dependents, or ABOD time limit. Now, for the work requirements, we're referring to dependents are individuals in the CalFresh household under 14 years of age. And we'll get into more information around that. Now, for Medi-Cal, you'll see three changes here on the timeline. The first is as of January 1st, customers with unsatisfactory immigration status cannot newly enroll in full scope Medi-Cal. Now, many parts of how Medi-Cal changes will happen in California are still being decided, and that will depend on state budget and policy decisions. So the other two that are upcoming are in October of this year and January of next year. So in October of 2026, at the federal level, those with unsatisfactory immigration statuses would no longer be eligible. However, California, again, is still determining how this is going to be implemented here at the state level. In January of 2027, work rules will begin for Medi-Cal, and eligibility will be checked every 6 months instead of once per year. Again, the Department of Healthcare Services is still finalizing that state guidance for the Medi-Cal program here in California. Next slide, please. Now for CalFresh changes, here's a simplified chart regarding the HR1 changes based on the provisions from the law. There are eligibility requirements for non-citizens and new work requirements for individuals who are 18 to 64 years old. Now, regarding eligibility, certain lawful non-citizens will no longer be eligible to receive CalFresh benefits. For example, asylees, refugees, parolees, and a couple of other classes. For work requirements, the age range is 18 to 64 years old, with some exemptions for customers. Now, the before and after that we're showing here is for non-citizens. Prior to April 1st, the non-citizen categories that were eligible to CalFresh were a little bit more expanded. So it did include eligibility for categories such as asylees and refugees. Now, effective April 1st, at the beginning of this month, certain non-citizen classes are no longer eligible. So for those new applications received on or after April 1st, they will be evaluated under the change of CalFresh eligibility. Again, those who are already receiving CalFresh will be evaluated at their next renewal, starting in the month of April and then moving each month forward. Now, just as a little quick call out for CalFresh, the certification periods can be 12, 24, or 36 months. So we may have touch points with these individuals who are already receiving CalFresh within 12, 24, or 36 months from when the provision was implemented. For the work requirements for able-bodied adults without dependents, or the ABOD time limit, prior to June, there are no provisions currently in place to apply the time limit. So San Diego has been on a waiver for a very long time. So as of right now, there are no provisions for us to be able to implement this time limit. However, effective June 2026, California as a state will re-implement the time limit. That means that it's going to look at individuals who are 18 to 64 years old, and it will exempt those who are parents or guardians or have a child under 14 years of age in the CalFresh household. Now, just as a note here at the bottom, we do include that some individuals may be exempt from the work requirements if they are physically or mentally unable to be employed. Next slide, please. Now for CalFresh, we'll start with the non-citizen changes. Again, as of April 1st, 2026, customers are eligible for CalFresh if they fall into one of the following categories. One, they are a United States or a U.S. citizen. Two, they are a U.S. national. Three, they are a lawful permanent resident or LPR. This non-citizen category is oftentimes referred to as a green card holder or for folks who have what we call an I-551. There is also a category of Cuban or Haitian entrant. And then lastly, the Compacts of Free Association citizen, which includes the countries of Palau, Micronesia, and the Marshall Islands. So we have those Compacts of Free Association citizens. And then if we can go to the next slide, please. Now we are going to cover who is no longer eligible for CalFresh. So here we're going to look at effective April 1st, we have various non-citizen categories who are no longer eligible. So again, that includes the categories of asylees, refugees, parolees, unless they are Cuban or Haitian entrants. Now for those of you who are not familiar with a parolee in terms of immigration status, this is going to be a little different than a paroled individual through the criminal justice system. This is a separate category through USCIS or the United States Citizenship and Immigration Services. The other categories include individual with deportation or removal withheld, conditional entrants, victims of trafficking, battered non-citizens, Iraqis and Afghans with special immigrant visas or SIVs, and then two categories of humanitarian parolees, specifically Afghan and Ukrainian, through the identified special dates here. Now, just as a also note with CalFresh non-citizen changes, those who are part of these non-citizen categories who will no longer be eligible to CalFresh may adjust their status to a qualifying category. So for example, once April first came around and let's say a refugee applicant wanted to apply for CalFresh benefits, they would no longer be eligible based on their non-citizen category. However, a refugee may adjust their refugee status to a lawful permanent resident or an LPR status, and at that point they would become potentially eligible to CalFresh benefits. So that's just an example of how a non-citizen may adjust their status. That's also going to include those non-citizens who also, for example, they naturalize to become U.S. citizens. So they would also become potentially eligible to CalFresh at that point and moving forward. Next slide, please. And then the second and final CalFresh provision is going to be for CalFresh work requirements. So CalFresh work requirements is regarding what we call the ABOT time limit. So the ABOT time limit means that adults ages 18 to 64 who do not meet an exemption will be limited to 3 months of benefits in a 36-month period. California is on a fixed statewide clock. That means that all counties in the state have the same 36-month period. The current 36-month period for California began on January 1st of this year, so January 1st, 2026, and will run through December 31st of 2028. Then in 2029, California will begin a new 36-month period. Now, ABOTs who do not meet an exemption must meet the work requirement to receive continuous CalFresh benefits. Now, adults who must meet the work requirements include, as listed here in the 4 dot points, individuals who are 18 to 64, do not have children in the CalFresh household under the age of 14, are physically and mentally able to work, and do not meet any other exemptions. Now, work requirements, when we say that, can be met by completing 20 hours a week or 80 hours a month through some of the following listed activities. So work, including self-employment, training, and volunteering. Now, the work activities and the work requirements can also be combined. So for example, you may have an individual who works 10 hours a week, and that would not meet the threshold of completing 20 hours a week. but that other 10 hours can be supplemented, for example, by volunteering with a community-based organization. So an individual may work 10 hours a week and volunteer 10 hours a week, and together meet that threshold of completing the work requirement of 20 hours a week. So that's how the various components can be either standalone 20 hours a week through work, or can be combined with multiple activities. So that's the overview of the CalFresh work requirements. And for CalFresh work requirements, we are still pending that final state guidance from the California Department of Social Services for the final policy on the administration of the program come June 1st. So thank you, everybody, and I'll go ahead and pass it over to Ramona.
Great. Thank you, Ricardo. That was very informative. Really appreciate you and your time for that. So, what should you do next? The most important takeaway is that if you are impacted by any of these changes, you will be contacted or informed during your intake interview or next recertification. So, it is very important to keep your contact information updated so you receive any notices and outreach. You can also visit your Benefits Cal account to make sure your email, phone number, and address are all up to date, and also check your renewal and recertification months. For more support, you can also go directly to Family Resource Center or call the Access customer service line. We've also linked our website that includes more information about the changes that are coming. Now, once your contact information is updated, be sure to check your mail and respond to any communications from the County of San Diego, including phone calls, texts, and emails. County staff will be reaching out in multiple ways, and this is how you'll learn if you are affected by any changes and what, if anything, you need to do next. But if your organization supports people that may be impacted by these changes, here are some more important links. This presentation and these links are available in the CalFresh Medi-Cal Changes Toolkit listed at the bottom in the blue bar and in the chat. The Changes webpage is updated as we learn more information. If you need enrollment support for your clients, see if your organization is a good fit for the Access CBO line. This line is available for CBOs to call and speak with a live agent to get general information, check on case and eligibility status, and much more. Organizations can also request a Live on Wheels with self-sufficiency staff to attend events. If you have job or volunteer opportunities, San Diego Workforce Partnership and Hands On San Diego are great places to list them. And sign up for e-newsletter updates, which include general resources and events around San Diego County. You can also request a presentation just like this one. There are tools and templates being created to support you in supporting the community. We will be updating the CalFresh Medi-Cal Changes Toolkit frequently. And the General Partner Resource Toolkit is also listed for general self-sufficiency tools and templates. Whether or not these changes impact you, there are many resources out there, and we are here to help you navigate them. Visit the self-sufficiency webpage to see all programs available. 211 San Diego is a great place to go for a variety of resources. You can search for job and volunteer opportunities to meet work requirements, as well as get connected to food resources. And finally, the San Diego Hunger Coalition, San Diego Food Bank, and Feeding San Diego all have food resources available. You can scan the QR codes for more information on each of these. We hope that this information and these resources will help you navigate these changes. Now I will pass it to Andrew to further talk about nutrition and security and community resources. Thanks, Andrew.
Thank you, Ramona. Hi, everyone. My name is Andrew Chousel, and I'm the AmeriCorps Vista Education and Outreach Specialist, and I'm serving my volunteer term with the San Diego Hunger Coalition. I am joined today by my colleague Anna Evangelista, and she is our Community Impact Manager. And together today, we're going to go ahead and share some information about the landscape of hunger in San Diego, and we're also going to provide some information on alternative food assistance resources. Alrighty, so before we go over alternative food resources, I wanted to take the time to highlight our data on nutrition insecurity in San Diego County. So nutrition insecurity means someone who cannot afford 3 healthy meals a day. And here at the San Diego Hunger Coalition, we define nutrition insecurity as households that are earning under the 225% of the federal poverty level. So for example, for a family of 4 in 2026, that's going to be under $74,250 a year. So that might sound a bit like a higher salary than people would expect, but with rising housing costs and childcare costs and food costs, many families who are actually working full time unfortunately still fall within this category. So let's dive a little deeper into what the nutrition insecurity rate is. Right now, more than 1 in 4 people in San Diego County are nutrition insecure. And something that I want to point out here is that if we look on the graph, we can see that after December of 2024, the nutrition insecurity rate actually increases to 26%, and then it actually drops down to 25% in December of 2025. So this marks the first time in a year that nutrition insecurity has actually decreased. However, that full year, that full sustained year of high levels of insecurity has resulted in a meal gap of 6 million meals in December of 2025. And that meal gap is one of the big focuses that the San Diego Hunger Coalition aims to address. Next slide, please. Alrighty, so this here is a little table that breaks down the numbers even further by different populations. So as I mentioned in the previous slide, San Diego County has a nutrition insecurity rate of 25% as of December 2025. And that's going to mean that 32% of children, 25% of older adults, and 37% of people with disabilities all across San Diego County are nutrition insecure. And this is really important because it does show that nutrition insecurity is more prominent among specific populations than it is with others. And if you guys are interested, we do have more information on that on our website available. And this here is a pie chart that breaks down the number of meals that were provided by the various food assistance programs across San Diego County, again in December of 2025. So one of the first things to note here is that the hunger relief sector all across San Diego County provided 27.7 million meals across all of these different programs. And as you can see, 57% of those meals are from CalFresh, which means that it is the most effective food assistance program in the county. However, as I mentioned earlier, despite all of these meals that were provided, the county was still short by 6 million meals. So this means that thousands of families went hungry around this time. And when we talk about CalFresh changes, we're talking about impacts on tens of thousands of San Diego County residents. And that's kind of why any shift in eligibility or work requirements, it affects entire communities as a whole. So with that in mind, we do have some action items that we would like to share with everyone. So organizations like the California Association of Food Banks, 211 San Diego, and Aliados Health, they are advocating for state funding to replace that federal funding that was lost, specifically to support federal outreach for programs like CalFresh. And so if you guys are interested in supporting some of these efforts, there's an organizational sign-on letter. And with that in mind, there's no formal deadline to it, but if anyone is interested in signing at all, that would help a lot. And we also encourage you guys to sign individually. There's also an individual quick email action as well. And then lastly here, we have our HR1 toolkit. This is going to highlight some of these changes that we've talked about in this presentation. And we like to keep it updated as time goes on as well. But it has a lot of different information and provides a lot of different resources for anyone that is in need. And it tries to condense it a little bit so that way it's streamlined and it's really easy to understand in that sense. Alrighty, and then I'll go ahead and pass it over to Anna Evangelista, and she'll talk about alternative food resources.
Thank you so much, Andrew, and hello, everyone. Thank you for having me. I am Anna Evangelista, and I'm the Community Impact Manager for the Hunger Coalition. And with that, we know that there are a lot of changes coming to CalFresh, and so it's very important to make sure that people know that there are alternative food resources that they can potentially turn to. And so in the next few slides, I will be going over some potential alternatives, including WIC, Sunbucks or summer EBT, meals for older adults, including congregate meals and medically tailored meals, and ending off with food distributions and pantries. Next slide, please. The first program that I want to highlight as an alternative is WIC, and WIC stands for Women, Infants, and Children. It is a federally funded nutrition program that is dedicated to supporting low-income pregnant individuals, those who are postpartum, breastfeeding, infants, and children up to the age of 5. WIC can help families through a variety of different benefits, the first one being monthly benefits for healthy foods. Families who get approved for WIC will receive a WIC EBT card that they can use to purchase specific approved healthy foods. These are foods that are tailored to the nutritional needs during pregnancy, infancy, and early childhood. WIC also provides nutrition education classes. So WIC participants can attend classes with topics like learning healthy eating habits and learning infant feeding cues. WIC also offers breastfeeding support as well. They offer both individual and group sessions, lactation peer support, and access to lactation consultants. In order to qualify for the program, you must be someone who is pregnant or someone who was pregnant in the past 6 months. This does include people who have recently given birth, had a miscarriage, or had an abortion. And lastly, any child under the age of 5 will also qualify for WIC, including those in foster care or those who are under the care of a father, grandparent, or any other legal guardian. And one really important thing that I want to note is that immigration status does not affect eligibility for WIC. So regardless of your immigration status, as long as you fall under these qualifying categories and you meet the income limits, you can get access to this program. Next slide, please. So similar to how CalFresh works, WIC has income eligibility criteria. In order to qualify for the WIC program, your income must be at or below 185% of the federal poverty level. And you can actually see a table here that helps break down what that looks like for each household size. I do just want to make a quick note. For household size, this will include unborn children. So if you are helping a mother who is currently pregnant, her household size would be considered 2 because you would be applying for benefits for her and her unborn child. And WIC income guidelines get updated every single year. This year they will be updated in June. So if you're ever working with people who are potentially over income, I do always encourage you to check back because these income guidelines do update every year and you could potentially become eligible. And one last thing that I want to note for this slide is the fact that military families can actually apply for WIC, as their housing stipend does not count as income for the program. Next slide, please. If you are interested in connecting to the WIC program, there are 5 agencies that offer WIC services throughout San Diego County, and each agency has multiple office locations alongside remote services that they can also offer. This includes both the American Red Cross, Scripps, San Ysidro Health, TrueCare, and the San Diego State University Research Foundation. If you are interested in connecting to any of these agencies, the easiest way to do so would be to visit sdwic.com. You would enter your zip code and it will provide you with a list of the closest offices alongside their contact information. And again, you can also apply online. You can call any of the offices and a staff member will help you begin that application process. Next slide. The next program that I want to take the time to highlight is Sunbucks, also known as Summer EBT. Sunbucks is a federal program that aims to bridge the hunger gap during summer when students lose access to free school lunch and free school breakfast meals, again, while they're home during summer break. Sunbucks provides $120 worth of food benefits per school-age child in the family. And these benefits can be used towards groceries or food. It works very similarly to the CalFresh program. And one important thing to note is that families who are on CalFresh or who have had been on CalFresh at any point during the academic school year are considered automatically certified for the program. And similar to WIC, immigration status does not affect eligibility for the Sunbooks program as well. So if you are working with any immigrant families who have lost eligibility for CalFresh due to the HR1 changes, Sunbooks is another potential program that you can point them towards this upcoming summer. Next slide. If you have any questions about Sunbooks eligibility, or if you need any assistance when it comes to obtaining a Sunbooks card come summer, we do encourage you to contact the Sunbooks helpline. Their helpline number is listed here, and you will also find it available on the CDSS website or our website as well. But you will simply follow the prompts, and it'll allow you to speak with an agent to receive help on your Sunbooks case. Next slide. Perfect. So another program that I just want to take the time to highlight is congregate meals for older adults. Congregate meals provide a hot meal for anyone who is age 60 or older. And similar to WIC and CalFresh, immigration status, again, does not affect eligibility to participate. HHSA's Aging and Independent Services have a nutrition services page with a list of providers that provide congregate meals every single week on different days throughout San Diego County. On the slide here, you can actually see a picture of what that list looks like. Again, these meals are available all throughout San Diego County. You will find them located north, south, central, east, and west. So I encourage you, if you are interested in getting a hot meal or connecting someone to a hot meal, please visit the AIS Nutrition Services page. Next slide. If you are working with any older adults who are unable to go in person to receive a free meal, there are some alternative programs, including home delivered meals. Meals on Wheels San Diego offers the choice of having 1 or 2 nutritious meals delivered directly to your home 7 days a week for a low cost. And the cost is made lower if you are a CalFresh participant. Deliveries are made by their volunteers, and they are able to accommodate certain diets, such as low sodium. If you are interested in getting connected to home delivered meals, we would encourage you to directly contact Meals on Wheels. You can give them a phone call or visit their website to see if they are in your service area. Next slide. Next, we have medically tailored meals. So these are free home delivered meals. Those who are on Medi-Cal with a qualifying medical condition can receive these home delivered meals through several different providers, such as Mama's Kitchen. These are organizations who, again, can provide up to 3 nutritious meals a day for those who qualify, and they will be delivered directly to your home. Again, they are meant to serve those who have chronic conditions, and Medi-Cal will pay for these meals completely as long as you qualify. Next slide. And the last alternative food resource that we just want to take the time to highlight is, of course, the food distributions and food pantries. Both San Diego Food Bank and Feeding San Diego do amazing work in coordinating food distributions all throughout San Diego County. And you can actually visit both of their websites to find a distribution map locator. These are maps that you can navigate. You can filter via zip code, day of operation, or type of distribution, and you'll be able to find the nearest distribution in your area. Many of these distributions accept walk-ins. Some of them may be appointment only, but because of that, we do encourage you to, of course, take a look at their website and make sure that you find the distribution that will work best for you or your client. Next slide. And as an additional resource, the Hunger Coalition has created a food assistance resource flyer, and we do update it currently on a bi-yearly basis. This flyer has information on all of the food resources that we just talked about, alongside links and phone numbers that people can call in order to get connected to each of these programs. This flyer is available in 13 different languages, and so it can be very helpful in connecting families to different food assistance resources. Next slide. And to wrap up, I just want to share that the Hunger Coalition does provide free trainings over Zoom. We have a CalFresh one-on-one training, which covers all things to know about connecting to the CalFresh program. We also have a Hunger-Free Navigator training where we go a lot more in-depth over the different food resources, including WIC, medically tailored meals, food distributions, and so on. So if you are ever interested in taking part and learning more about these different food resources, please feel free to join us. You can always find the links on our website. And with that, thank you so much. This is the contact information for Andrew and I. So if you ever have any questions, please feel free to reach out to either of us.
Great. So thank you so much, Anna and Andrew. Really appreciate all the information and resources that you shared. Now, we do have some time for questions, including questions submitted during registration. But for those of us here with us, please continue to put your questions in the Q&A box and we will answer them as we have time. So first, I would like to invite everybody back to come on screen and we'll get to our questions. Thank you. Okay, so our first one, we'll get into just some questions about general benefits. This first one is for Ricardo. So is it true that when legal residents receive public benefits, their sponsors are required to repay the cost of those services once the residents become citizens?
Thank you for the question. I can answer this for both Medi-Cal and CalFresh. So for Medi-Cal, sponsorship deeming is not evaluated, but for the other non-citizen provisions, final guidance is still pending for or from the Department of Healthcare Services regarding the upcoming policy changes for non-citizens. For CalFresh, the program is not considered public charge, and so neither the sponsor nor any other individuals are required to repay CalFresh benefits if a lawful permanent resident becomes a U.S. citizen.
Great. Thank you. And now this next one I have is for Anna and Andrew. How will disabled individuals prove that they are disabled? Will Social Security statements suffice?
Yes, so exactly. If you'd like to prove that you have a disability for CalFresh, either to prove that you are exempt from work requirements, you have to show that you are receiving some kind of disability benefit. So you can provide proof of a, SSI, your Social Security statements, supplemental security income. So yes, as long as you can show that you are receiving some kind of disability benefit.
Okay, great. Good to know. Love that. Thank you. And now shifting topics a little bit, we're going to go into eligibility. This first one, we're going to go back to Anna. So will AmeriCorps stipends count as income?
So certain AmeriCorps stipends are exempt from income for the CalFresh program. However, it will vary based on each situation. For example, according to the CDSS All County Letter 1241, this AmeriCorps income may not be exempted if the individual who joined the VISTA program was not already receiving public benefits or food stamps at the time of joining the AmeriCorps program. So again, it will vary based on each situation. If you have a specific situation in mind, I would encourage you to please reach out to us and we can help you gauge if their income will likely be exempt or not.
Great. Thank you. And I appreciate the support too for clients. It's great. The next question, again, regarding eligibility is going to be for Ricardo. So can parents with unsatisfactory or undocumented immigration status still apply for benefits on behalf of their children?
Thank you for the question. And the short answer is yes. So parents who are undocumented or who might have Otherwise, unlawful presence here in the country or are even part of ineligible non-citizen categories can still apply for programs, for example, CalFresh or Medi-Cal on behalf of their eligible children.
Okay, good to know. Want to make sure we still have the supports for children here in San Diego County. I appreciate that. So we're going to get into some work requirements, and I believe, Ricardo, these are going to go more towards you. So we're getting into the finer details of work requirements here. So how often are people required to report their work hours or volunteer hours?
Thank you for the question. So people only need to verify their work or volunteer hours at renewal, unless the program specifically requires them to report a change earlier. So monthly reporting is not going to be required for the re-implementation of the ABOT time limit, unless individuals are told otherwise if they have a mandatory reporting requirement.
Okay, cool. Thank you. And so you covered part of this question earlier in your presentation, but is there flexibility in meeting the required hours? So you did talk about mixing volunteer work hours, but does this also apply to remote and virtual work as well? Can you mix it between a virtual job and an in-person volunteer opportunity?
Yeah, so there is going to be some flexibility in how required hours are going to be able to be met. So participants, like I had said earlier during the presentation, can combine different approved activities, for example, employment or work, job training, school, and volunteer or community service hours to reach the total monthly requirement. As long as the activities are verified and they meet the program guidelines, then mixing those components in order to get that threshold requirement for the monthly work requirement is going to be acceptable.
Okay, great. Thank you. Now, how do work requirements impact anyone who is self-employed?
Sure. Self-employment is not going to be impacted any differently for individuals than it would be for any other wage earners. So for the ABOT work requirement, hours spent running a business can be used to meet the work requirement. We are still pending that final guidance from the state to identify the finer details of it, but there is no difference between self-employed individuals and those who are, for example, employed by our larger employer.
Okay, well, thank you. Good to know. I believe that's especially important since we have a lot of small businesses and entrepreneurs here in San Diego County. So thank you. Now I'm going to get into some general support questions, which maybe we'll go to both of you to help answer some of these. So generally, how can nonprofits support with opportunities to clients? And maybe start with Anna and Hunger Coalition. Yeah.
Yeah, perfect. Thank you. Nonprofits can continue to support their clients by really acting as their advocates. Nonprofits have staff that are dedicated to helping clients with their applications, so they can help the client speak directly with the county regarding any questions they may have, and they can help them understand any of the new rules that are in place for CalFresh. And as we stated earlier during the presentation as well, many nonprofits do offer alternative food resources and alternative services, such as weekly food distributions. So many local nonprofits will be able to provide you with emergency food resources.
Great. Thank you. And Ricardo, do you have anything to add?
Yeah, so thank you so much for that information, Anna. And I can also add on that nonprofits can support by offering approved flexible activities that help the customers meet the required hours for the work requirement. So this can include, but it isn't limited to, for example, volunteer or community service opportunities, workshops, job training, or skills building classes. They can also help by tracking or verifying hours and by also connecting the customers to other partner agencies that might offer additional qualifying activities as well.
Okay, great. Thank you. I know we also mentioned earlier Hands-On San Diego, so it's also a great resource to stay connected there and make sure that you're connected with them. So my next question is, what resources are available for unhoused individuals now that the homeless status exemption has been removed? So maybe I'll start with Ricardo on that one.
Thank you so much for the question. Homeless individuals can still access shelter services, case management, document help programs, and benefits like Medi-Cal and CalFresh through local providers, even without the HR1 exemption. They can also use service provider addresses and verification letters to meet new documentation requirements. So there's still some services and resources out there for unhoused folks.
Great. Thank you. And Anna, is there anything else that might be available for those who are unhoused?
Yeah, I will actually let my colleague Andrew answer this one.
Awesome. Thank you.
Thank you. So I guess for kind of to bounce off of what Ricardo was saying, homeless individuals can also access other food assistance programs. So food distributions are one that are going to be really popular, as well as congregate meal sites. And then many other organizations provide walk-in food distributions or have like a set planned meal time where people can actually come in and receive a hot food. So that's another one to definitely keep an eye out for.
Awesome. Thank you all so much for those questions. Really appreciate it. That is all the time that we have for today for the questions, but I really appreciate your time and your expertise guiding us through this, really tough topic, but really appreciate everything that you are here to share and support our community. Thank you. So, again, thank you to everybody for joining us today. And we would like your feedback on our presentation. So if you could please scan the QR code on the screen or clicking on the link in the chat. We would love to hear your feedback for this presentation. As always, you can stay up to date with webinars and resources like this one today by visiting the county website on CalFresh and Medi-Cal changes and subscribing to our newsletter. The links are in the chat. Okay, thank you all for your input. And if you did not have the time, please know that this is going to be included later. And that's all our time together today. We appreciate each and every one of you showing up and joining us today. We hope to connect with you soon. Thank you.